Hey guys, welcome back to my channel. It's your girl, Michelle N. Johnson, and this is Fighting Fiercely, the space where we educate, enlighten, and empower about all things endometriosis related. If you're just finding me for the first time, welcome. I hope you enjoy what you guys are going to hear today. And also don't forget to click the like and subscribe button, and don't forget to give us a thumbs up because YouTube is all about the thumbs up, and it really helps to increase our viewership and allow us to get more information out to more people. So let's get into it. So we're in April, nearing the end of April. And if you guys weren't aware, April is Adenomyosis Awareness Month. And I wanted to come to you and do a video talking about adenomyosis because if you're someone who has been diagnosed with endometriosis, chances are if you haven't also been diagnosed with adenomyosis, you've definitely heard about it. And I thought that it was super important to talk about this today because the two conditions are so very closely related, so much so that adenomyosis is often referred to as the sister disease or cousin disease to endometriosis. And there's so many similarities between the two, although they are vastly different diseases. And so I thought it was important to talk about that so that you guys could have some clarity and education and information, and also think about if you should talk to your doctor if you have been diagnosed with endo and it's been ruled out, but you keep having a lot of these symptoms. It may be worth having a discussion with your doctor to see if adeno may be the culprit. So let's get into it. What is adenomyosis? So adenomyosis occurs when the normal lining of the uterus, called the endometrium, when that invades or embeds itself deeply inside the muscular wall or the belly of the uterus. Now, this is not like endometriosis. It's important to make this distinction between the two because endometriosis occurs when tissues and cells that are similar to the lining of the uterus. It's important to note that they're similar to those cells, but they are abnormal and they have their own pathology and behavior, and it's very different when those cells are found outside of the uterus. But adenomyosis is the, if you want to say, extension, if you will, or protrusion, if you will, of the actual lining of the endometriosis into the belly of the musculature of the uterus. So if you want to think about it like this, adeno is found inside of the uterus as opposed to endometriosis, which is typically found outside of the uterus. And we know that endo can be anywhere from the lungs, the pelvis, the kidney, the diaphragms, whereas adeno is strictly confined to the uterus. Many years ago, adenomyosis used to be referred to as endometriosis interna, meaning endometriosis inside the uterus. And if you've been in any of the social platforms or online endo communities, you will hear sometimes people will still refer to adenomyosis as saying, oh, it's just when endo invades the uterus. And that is actually incorrect. Adenomyosis has since been established as its own separate condition. It's a different disease entirely, although a large percentage of women with endo will also have adenomyosis. Now, a lot of my research that I did for this video, I referred to Dr. Andrea Vidali, and I will be putting the link for his information and the links to the references, as I always do, so that you guys can go and get more detail about what we're discussing here today. But according to Dr. Vidali, much like endometriosis, there is no definitive cause as of yet, although there are several theories that abound. And also, unfortunately, much like with endometriosis, women who experience symptoms of this disease are often told that they are fine, and a lot of women just simply get ignored for their symptoms. So let's talk a little bit about the pathology of endometriosis and adenomyosis. And I know that a lot of this is probably going to be a bit confusing. So if you missed something or you have questions about something, please feel free to drop down in the comments and ask your questions. And I will do my best to clarify for you or to point you to the sources that I use so that you can gain further clarification. So with regard to the pathology of adenomyosis and endometriosis now, In my research, when I found this out, I was actually shocked because, and even I used to say this years ago, early on when I first started doing my advocacy, you'll hear a lot of people will say, well, endometriosis, there's cells that are similar to the lining of the uterus, and much like the lining of the uterus, they break down and shed and bleed internally, and that's what causes like the chocolate cyst and the organs to stick together. That is not true. I know, right? I was actually blown away when I realized this. So let's break this down. So according to endo specialist Dr. David Redwine, you guys know I've referred to him before. Endometriosis does not bleed. The abnormal endometrial like cells, they don't bleed. They do not mimic the shedding and sloughing and all of that stuff of normal endometrioma. Of normal endometrium. Why? Dr. Redwine states that endometriosis is comprised of stroma and glands. Glands secrete, they do not bleed. Glands secrete. Blood vessels and capillaries bleed. And so what happens is those glands and that stroma from endometriosis will sometimes latch on or leech on to those nearby blood vessels or capillaries and will cause them to burst or bleed, and thereby causing the internal bleeding or sticking together or fusing together of organs as related to endometriosis. Okay, got that? So the chocolate cyst and the internal bleeding and everything, that does still occur. That is factual. That occurs with endometriosis, but it's not a result of the endo bleeding. Okay, that makes sense. Now, in contrast, because adenomyosis is, again, we talked about that extension and protrusion, it is actually the lining of the uterus that does bleed and shed and break down every month. And because those are the cells that are embedding themselves into the muscle belly of the uterus, those cells are the ones that shed and grow and slough and bleed and break down in concurrence with your monthly period. So both diseases can cause internal bleeding, but by two different mechanisms, if you can say. So again, adenomyosis, the bleeding and shedding that occurs from adenomyosis, is directly related to your period. It's behaving the same way that your normal lining of your uterus does on your period, not endometriosis. The bleeding that comes from endometriosis, according to Dr. Redwine, is more than likely a result of nearby capillaries and blood vessels that have bursted because of the glands and stroma of endo being wrapped and intertwined with them. I know, right? Like I said, I used to say that give that definition early on when I started advocating, but when you know better, you do better. And you guys hear me talk all the time about educating, enlightening, and empowering. This is why we educate. As we learn new and accurate information, I pass that along to you guys so that you guys can be as informed, accurately informed as possible. So, moving on to diagnosis. Most people you'll hear say that hysterectomy can only be diagnosed by hysterectomy after the biopsy is done, and pathology reports confirm that. But Dr. Vidali states that if it is severe enough, it can be seen on an transvaginal ultrasound, but an MRI is better. Typically, the uterus gives an enlarged appearance and what doctors have referred to as a soggy or boggy uterus. I know that when I was diagnosed with adenomyosis, my doctor said that my uterus had the appearance of like a 3 to 4 month pregnancy. So it was very much enlarged and distorted because of the heaviness and the sogginess, excuse me, of that. And with my story is I was initially thought to have endometriosis maybe about 2 years after my initial diagnosis with endo. There were irregularities and abnormalities that were in fact seen on an ultrasound. But for me, because my case was so severe and I had other things going on, I actually ended up needing to have a biopsy of some uterine tissue, and my case was actually confirmed via the biopsy before maybe 4 years later when I actually got my hysterectomy. So again, typically they'll say hysterectomy is the only definitive way to diagnose it. But again, depending on your circumstances, you may be able to see it on an ultrasound or MRI. And this may lead to some of the confusion, again, in the endo communities, because these diseases are so interrelated and so overlapping. You'll hear people say, oh, if the endo is bad enough, my doctor found it on an ultrasound or an MRI or a scan or whatever, when in fact, what they may have been looking at may have been adenomyosis. Okay. And it's also important to note that adenomyosis can also be mistaken in ultrasounds and scans as fibroids. Okay, which is why confirmation by pathology report is so important, because you got fibroids, you got endo, you got adeno, you got all of these diseases occurring in and around the same area, and a lot of the symptoms and visual cues of them look the same. And so that's why it's important, if you're going down like a symptom checklist with your doctor and this is being ruled out and that's being ruled out, it's important to keep going and to look at all possible causes, including adenomyosis. So now I want to talk about some of the symptoms of adenomyosis, and this is going to get really hectic, because again, there's so much overlap between this condition and other conditions. As I mentioned before, a lot of times it is mistaken for fibroids, but it is also mistaken and misdiagnosed sometimes for endometriosis, IBS, along with other conditions as well. Both can cause infertility, but with adenomyosis, infertility is typically caused due to blockage of the fallopian tubes, and that occurs about 50% of the time, as compared to, we know about 40% of people diagnosed with endometriosis is infertile. So let me go back, just checking my notes here. So both can cause adenomyosis. And adeno is due to blockage of the tubes. And endo results in 40% of infertility. And it says in my notes, I couldn't find any specifics about the percentages of like what percentage of patients are ruled infertile because of adeno. But in the cases where you are infertile from adeno, 50% of the time it's because of blocked tubes. So I just wanted to clarify that. I'm not saying that 50% of women with adeno will be infertile. I'm saying that in cases where women with adeno are infertile, 50% of the time it's due to blockages in the tubes. And I suffered with that several times. My tubes would fill up with fluid, and sometimes it would have to be drained. Sometimes it would dissipate on its own, but it would be this back and forth. And that really compromised the elasticity of my tubes and also the viability of them. And I did end up losing them. So a few other things to note about adenomyosis. Again, 50% of women with adeno also have fibroids. Okay. It can have up to a 50% miscarriage rate. So if you find yourself someone that has had multiple miscarriages and endo has been ruled out, it's worth having a discussion about possible adenomyosis. And then also 40 to 50% of patients with adenomyosis are also likely to have endometriosis. Okay, so that's what I was talking about earlier, where all of this can get a little bit overwhelming because you've got all of these overlapping symptoms. You've got a lot of the occurrences like infertility and miscarriages that happen between the two. And then now you've got almost 50% of the women with one are likely to have the other. So it can be very confusing, but that's why we're talking about it today. So that, again, if you're having these symptoms and these things, and endo has been ruled out, or IBS has been ruled out, or, PID has been ruled out or whatever, you can come back and make sure that you are exhausting all of your options for possible causes of your pelvic pain. Now, in my research, I was really shocked to find like some of these overlapping symptoms I knew about, but some of some of them really surprised me. So reading from the Mayo Clinic, and we've talked about the Mayo Clinic before, I've got a love-hate relationship with them because a lot of information on their site with regard to endo and adeno is inaccurate. But with this, they were on point. So some of the symptoms that they list, and again, much like endometriosis, some women will have excruciating pain. Some women will not have any pain or sign or symptoms at all. And also, much like endometriosis, the amount of pain or symptoms that someone experiences is not a direct correlation to severity of disease. Okay. So some of the symptoms, heavy or prolonged menstrual bleeding, severe cramping or sharp knife-like pelvic pain during menstruation. That was one that I absolutely suffered with. Talks about menstrual cramps that last throughout your period, pain during sexual intercourse, and blood clots that pass through your period. It also says that your uterus may get bigger, and even though you may not be aware of whether or not your uterus is enlarged, you may feel like your uterus, your lower abdomen feels like bigger or tender, especially when you get pelvic exams or just, throughout the month, you may find that it's like really tender to the touch and you always feel bloated or your abdomen is always distended. Now, when I went and looked at healthline.com, right? It was almost as if the same symptoms that they listed for adenomyosis were the same things that they listed for endometriosis. So let's take a look. So adenomyosis, painful periods, dysmenorrhea, painful sexual intercourse, dyspareunia, chronic pelvic pain, and an enlarged uterus. So aside from the enlarged uterus, with endometriosis, same things, painful periods, painful sex during intercourse, pelvic pain. Now, Healthline also mentions like painful urination, fatigue, nausea, and diarrhea, especially during your period. And they also list painful urination. And in a lot of circles, the defining characteristics of like painful urination, the painful bowel movements, those things were typically related to endo, right? But moving a little bit deeper into the research, looking at Dr. Tamir's second, you may have heard me reference the second endometriosis center before, list also symptoms of endometriosis and adenomyosis. And I've got to tell you, the same 8 symptoms that was listed for one is listed for both. So let's go through them. Painful periods, heavy menstrual bleeding, which can include clots, painful bowel movements, bladder symptoms, including uncomfortable urination, burning urination, or blood in the urine. And remember, typically before, the urine symptoms were typically related to endometriosis. Painful sex during intercourse, inflammation of the uterus, deficiency of blood cells, or severe anemia. Those were listed word for word as symptoms for both endometriosis and adenomyosis. And forgive me, I'm just looking down back and forth in my notes. But the one symptom that kind of surprised me as it related to adenomyosis, I hear this talked about a lot with women with endo. And I've experienced some of these as well. But again, in layman's circles, you hear this referenced a lot with endo, but this can also be a symptom of adenomyosis as well. And that is peripheral nerve numbness or weakness, which can cause leg or bowel pain during periods. So a lot of women talk about having severe sciatica or neuropathy, numbness or weakness in the legs. And again, in lay circles and even from some doctors, that had typically been attributed to endometriosis. But again, here we see by Dr. Second, it can also be a symptom of adenomyosis. See how crazy this can get? But it's also important to note that this is why it's important to have these conversations. And for as widespread as endometriosis is, and very few people has heard about it, I feel like even fewer people know about adenomyosis. And even in my own research, I had to do a lot of research, a lot of digging. And I still feel like there weren't enough resources readily available that should have been. Okay. So again, if you guys are experiencing any of those symptoms and endometriosis has been ruled out, it may be worth, revisiting and mentioning to see if adenomyosis is a cause. So in researching the symptoms, one hallmark distinction that I did find appears to be that while endo symptoms can present through the entire month, adenomyosis symptoms seem to coincide with and be most prevalent during your actual period, like during the time that you are actually bleeding. And again, this isn't always the case, but just in my reading and research, that was something that jumped out in several different articles and studies that I read. So again, this isn't always the case. Every woman is different, but generally, very broadly speaking, a lot of times the endometriosis pain can happen at any time of the month, as with adeno pain. And I know this to be true for me, the severity of it, like the height of it, like when it's really off the charts, seems to be in correlation with your actual monthly flow. So what can you do to treat this disease? If you have adenomyosis, what can you do? And before we talk about that, I think it's important to discuss the different types of adenomyosis. Yes, there are types. And again, if you've been in any of the online communities or support circles, you very rarely hear this talked about. You just hear adenomyosis and hysterectomy. So I hope you guys can see my little diagram clearly, but if you guys take a look at the diagram here, you can actually see that there are 3 photos listed, and the 2 types is focal adenomyosis, diffuse adenomyosis, and then in the middle we have that tumor there, which is called an adenomyoma. Much like with endometriosis, it's called an endometrioma, which is just the large tumor there. Now, focal adenomyosis, as you can see, it's relegated. It's just in one spot here. Okay. I'm sorry, I'm trying to get so you guys can see it clearly. But it's just in one spot. Okay. It's just in one localized area. Or you see the adenomyosis here, the adenomyoma, is just in one particular area. And so according to Dr. Vidali, if you have focal adenomyosis, if it's just in one spot, or you have the adenomyoma, which is just in one spot, if the specialist is skilled enough, they can remove those local areas of adenomyosis without having to remove the uterus. They can keep your uterus intact. The last type here, going back to, is the diffuse. And as you can see, it is all throughout. There's the uterus right there. It's all throughout the musculature and all throughout the wall of the uterus. And unfortunately, diffuse adenomyosis is the type that most women have. And that is the type because it would be very difficult, right, to go in there and, pluck out or excise like all of these different, pull out from the uterus and keep the uterus intact. And so that's why for most women who have diffuse adenomyosis, is why they say hysterectomy is the best option for that. However, there are some other treatment options that are not as well known, and according to Doctors Vidali and Redwine, are not as effective. But again, my job is to give you the information so that you can make what? Informed, consensual choices. So let's talk about it. So the one I already mentioned was hysterectomy. It's the most common. It often involves the removal of both the uterus and the fallopian tubes. But much like with endo, if your ovaries are healthy and intact, you can leave them. Another treatment that I've heard discussed a lot is endometrial ablation. And this is a procedure that basically where they go in and they destroy or laser away the lining of your uterus, the endometrium, right? And the goals of endometrial ablation is to reduce the menstrual flow. It can be done in a variety of methods, including electrosurgery, cryoablation, hot saline. I was surprised to find that out. A heated balloon, didn't know about that one either. Microwaves or radio frequency. However, according to Dr. Vidali, endometrial ablation, and I'm quoting here, doesn't do squat. Okay. He goes on to say that it may temporarily decrease bleeding, but it doesn't help with pain, that the pain will generally persist and actually lead to more surgeries. And it can also cause more discomfort and more scar tissue. But again, everything isn't for everybody and people have to make their own choices. Some women, depending on where they are in their journey, has had their procedure and it's maybe bought them some time or given them some temporary relief while they figure out, what their next steps are, what they want to do. But the overall consensus from Dr. V, at least, is that it's not an effective solution in the long term. Now, this next form of treatment, I've heard of it. I've read a little bit about it, although I'm not very familiar with the process. And that is uterine artery embolization. Okay. Now, this procedure is typically given to women to treat fibroids, right? And it's been proven to be an effective treatment for women with fibroids. And so what this procedure does is tiny particles are used to block the blood vessels that provide the blood flow to the adenomyosis. The particles are guided through with a tiny tube and inserted into the patient's femoral artery. With the blood supply cut off, the adenomyosis shrinks. However, again, it states that this procedure is more commonly used to shrink fibroids. A handful of women that I know have had this procedure done or have talked about looking into this procedure. Now, I did do some follow-up research with this, and I found some data based on some studies. So one research study that I looked at, it was done back in 2008, and it did seem to suggest that this was not an effective long-term treatment for women with adenomyosis, and that they had to come back and have other forms of treatment, and some of them ultimately hysterectomy. Now, following that, though, I found another study, a more current study that was done in 2017. And according to this study, so what they did a follow-up study on women who had this procedure done between 2006 and 2010. And then they followed up with them 7 years later in 2017. And that study seemed to suggest that 82% of those patients that had the procedure done were successful in avoiding a hysterectomy. But I do need to point out that in that study, the group was only 29 women, which was very, very small sample size. And 15 of those 29 women also had fibroids. And so we know that this UAE is proven to be a successful procedure for women with fibroids. So did that have anything to do with their success rate as opposed to the adeno in general? I can't say for sure, but I will put that link down below for that study if you're interested in reading more about it. The last treatment option is very controversial, and I've only heard of it vaguely in passing. And in fact, Dr. Vidali describes it as one that is very radical and one that he only uses for extreme cases. As a matter of fact, while he does perform this procedure, he is the only endo and adenomyosis specialist that I know of that performs this procedure. And it is called the OSADA procedure, OSADA. And again, I will put a link to the YouTube video that I got this information from, with Dr. Vidali himself speaking about this procedure. He says that it involves open abdominal surgery where the uterus is split in half to remove disease. So again, this is a very complicated procedure. Not very many doctors are versed enough to do it. And again, like I said, in my research, I believe he's the only one that I found who does this procedure. And in that video, and I'll do a separate link. He does provide like his contact information and indicates that he offers free consultations if you think this might be an option that you want to investigate. So, as we get ready to wrap up, to close it out or to summarize it, Dr. Vidali says that when endometriosis and adenomyosis coexist, once you've had surgery for endo and pain is still present, it may not necessarily be that the endo has returned. And we hear a lot of women say that, right? But rather, it could be that the adenomyosis was the primary source of pain all along. And once you removed endo from the equation, you got rid of that source of pain, but it kind of gave way for the endo symptoms to make themselves more known, for lack of a better word, right? And that's my word, not his. But he talked about, especially if you have the pain and the bleeding, he calls it crazy bleeding, nonstop bleeding, science fiction type level bleeding is what he says. So again, if you've been diagnosed, as I've been saying throughout the video, if you've been diagnosed with endometriosis, if you've had surgery for endo and you're finding that your symptoms are still persisting, especially when you're on your cycle, especially when you are bleeding or having your flow, it may be worth discussing with your doctor if adenomyosis could be a potential contributor to your ongoing pain. So that is it, you guys. I hope that helped to clarify for you a little bit more what adenomyosis is, to give you that distinction between endometriosis and adenomyosis. I know that there's a lot of overlap between the two, but again, those hallmark distinctions that I found seem to be the heavy bleeding, the prolonged bleeding, the passing of blood clots, and symptoms heightened more specifically during your period. Those were the four standouts that I found that seem to be more specific to adenomyosis. So I hope, as always, that you guys have been educated, enlightened, and empowered by this video. I hope that some of your questions have been answered. If you've been having these symptoms and haven't been able to put a finger on it, or if you find yourself frustrated or despondent because you were certain that you had endo and you've had the surgery and the lap done and it came back negative, and nothing was found for that, I would say, just like I say with endo, you are not crazy. You are not alone. And what you are experiencing is not all in your head. In fact, it just might be adenomyosis. So that's it again, you guys. Thank you so much for watching. I hope that I have done a good job today in educating, enlightening, and empowering you. If so, again, don't forget to drop down in those comments. Let me know. Like and subscribe. Please share this video so that someone can be helped. I always get choked up at the end of the video. I got to work on that, you guys. But again, like, subscribe, share. Any questions or concerns, drop down in the comments. As always, I'm here to help